fireside.com. So this is the website I have created to promote health and wellness. And the purpose of these fireside chats is really to bring to you information that will be valuable in terms of your health and wellness. And with that, I'm going to also introduce Dr. Gupta here in a second. So hopefully you can see this slide, right? Sanjay, do you see this slide?
Yes.
Okay, perfect. Okay, good. So again, I want to welcome all of you, and let me begin by emphasizing that the purpose of this talk is really to provide general information. So you should not act or do anything about this without first consulting your physician. That is really important. This is not considered to be, or it's not to be construed or considered as medical advice. Everybody is different. So please do not act on any of this information unless you talk to your primary care physician. Okay, so with that disclaimer about how you will use this information, I'm going to introduce Dr. Sanjay Gupta, who is a really renowned doctor. He practices internal medicine. He has been doing this for the last 25 plus years. And he is currently an attending physician, internal medicine physician at the Weirton Medical Center near Pittsburgh in West Virginia. And he has enormous knowledge and enormous background. And Dr. Gupta, if we were to talk about health and wellness and what we are going to discuss today, will literally be scratching the surface with the experience that you have. Each of the topics we could be doing almost like an hour or longer presentation, and that's such a wealth of knowledge that you have through your nearly quarter century of your experience. Dr. Gupta is a board certified internal medicine physician, as I mentioned before, and he got his medical degrees, MBBS, from R&T Medical College in Udaipur, which is located in Rajasthan, India, followed then by a residency that he completed in St. Francis Hospital in Pittsburgh. So with that, Dr. Gupta, I want to welcome you to this, and let me quickly give the audience a little bit of idea of what we are going to talk about. And then I will hand over the stage to you. So health and wellness and talking to somebody extremely knowledgeable like Dr. Gupta is, it's really trying to boil down the ocean. He has so much knowledge, so much wealth of information. So we have decided that we will talk about a few topics. And then if needed, we can always come back and do another fireside chat with Dr. Gupta as well. So the way I see this is we have framed this as kind of looking at A through Z of health, right? So we are going to talk, what do I mean by that, right? So A, for example, Dr. Gupta will explain, relates to the so-called A1C, which has to do with blood sugar. B is blood pressure. C is cholesterol. D can be thought of as vitamin D and other supplements. What are the pluses and minuses? Who should take them? Who should not take them? E is exercise. Exercise and physical activity is said to be cure of almost everything. And then F is for focus in terms of how we can stay less distracted, how we can be happier if we are able to focus, and that relates to stress management and mental health. And the last alphabet, of course, is Z, which is the sleep, which is very important in terms of stress management. And what you see there on the slide is the Rubik's Cube, which is meant to show that all these things are interconnected. And Dr. Gupta is going to do a great job of explaining that we have one body, one mind, one soul, and how all of these factors, okay, your A1C, your blood pressure, your cholesterol, the food, the nutrition, exercise, physical activity, all that is tied into your mind, body, and spirit. Okay. And how do we? So it's not one thing at a time. You cannot just address one issue at a time. They are all interconnected. Okay. So I think with that, I'm going to. Can you see me, Dr. Gupta? So
Yes, yes,
perfect,
yes.
perfect. So now I really let's get into the conversation here, right? So I'm going to first give you a chance to kind of say a few words to our listeners, right? And then we'll kind of make a little bit deeper dive into all these things that we
Absolutely.
talked about. We may or may not be able to get to everything, but we'll do our best. Okay. So with that, I'll let you go ahead and say a few things that's on your mind.
Sure. Thank you, Pradeep, giving me this opportunity. And to all the audience, hello. I'm glad that you were able to join in. And Pradeep is doing a tremendous job arranging these fireside chat series, doing a great work to help the general public, especially Southeast Asians. And I'll be glad to be part of this. And in spite of his busy schedule, he's putting time in to all this together. And then also, as we all know, he's a uh, great athlete, musician, and so many and so forth things.
Yeah.
Great.
Perfect.
All right,
Thank
Pradeep.
you.
So,
Thank you, Dr. Gupta. And I really, really want to emphasize this that all of my friends, like Dr. Gupta and the other two fireside chats coming up very soon, will be Dr. Indu Purnima. Dr. Gupta, you know that that's coming up soon, and that will be right after Valentine's Day. That's on February 16th. So she'll be talking about cardiovascular, heart related issues, and in the context of nutrition. And then my other good friend, Dr. Ginde, Mayura Ginde she is a dentist and a very qualified one, and she'll be talking about the importance of oral and dental hygiene. So those two are lined up, and you can look for a couple of more that will come up. So with that, right? So Dr. Gupta, we have a lot of ground to cover, right? And I
sure.
think there's so much, like I said, you have so much knowledge that I think it's hard to condense all that into and 1 hour.
Yeah, I will try to be non-technical, non-medical, very simple, so everybody can follow.
Everybody can follow. That's why we call it a fireside chat. This is not a lecture. This is not a webinar. And it's certainly we are going to stay away from the medical terminology. Okay. So we talked about A, B, C like that. And let me actually flip it around a little bit. Let me start with blood pressure. All right. So can you kind of just tell us, most people kind of know that they have a number that is a higher number and a lower number, right? So blood pressure. So 110 or 120 over 80, something like that. So can you tell us what does the lower and higher number mean for blood pressure?
So when we talk about blood pressure, basically it's a pressure in your peripheral vascular system. The heart has to pump blood against that pressure.
Mm-hmm.
So a normal person, that's let's say 120 over 80. AMA has given a newer guideline, and upper number is
AMA is
systolic.
American Medical Association.
That's correct. That's
American
correct. So upper number is higher number, which is systolic, when the heart pumps the blood out to the whole body, oxygenated blood. And lower number is diastolic, with basically the heart relaxes, all the deoxygenated blood comes back to the heart after it gets cleaned out in the lungs, oxygenated, and then the heart pumps back. So it's a whole cycle.
Mm-hmm.
So systolic blood pressure is your upper number. The higher it is, that means heart has to work more. And the lower number is diastolic, when the heart's trying to relax in between the each pump,
Correct.
each time pumping the blood out.
Correct. And so, so elevated blood pressure, that means blood pressure that is higher than kind of considered normal, right? So what would you say is the normal range of?
So concerns, there are different bodies, JNC8, American Heart, College of Cardiology,
Mhm.
different numbers. Of course, the AHA and ACC, they have the new readings. The normalization number is about 120 over 70,
Mhm.
which is pretty strict compared to previous readings. So AMA came up with a good thing, step 1, step 2, which they up from 120 to 129. They made a step, the upper number, which they made about step 1, stage 1, and stage 2 is 129 to 139. Above 140 or 190 is definitely considered as hypertension.
Mhm.
So when you are in stage 1, you still have opportunity to make some non-medicinal changes in your, like, basically treatment with the low salt. We'll be talking about that, and changing your lifestyle to control that number and keep it either that or maybe a little bit better.
Mhm.
So the normal blood pressure for all of us is all these different recommendations about 120 over 80. And if it's above 140 or
Correct.
190, definitely needs intervention.
Correct. So can you explain why the higher blood pressure, if I'm walking into your office, right, and you measure my blood pressure, right? So a couple of things on that, right? And if you find that my blood pressure is higher, right, why is that? Why should I, why should it doesn't hurt me, right? I mean, I may have high blood pressure. It causes no pain, right? So
That's
these
correct.
are what you have been calling as silent killers, right?
Silent
So
killers. That's
why
exactly.
is high blood pressure such a big problem? Why
So
should we pay attention to this?
yeah. So blood pressure, persistent high number, the upper number, mainly we focus on that, is detrimental to our arterial blood system, and which is could be cause of the atherogenesis, which is blockages, heart attack, stroke, kidney failure, poor circulation. So it's been linked to all that. And
Mhm.
even a slightly higher number, even though it's not giving any pain or the other symptoms, can be detrimental in long run. So
That's right.
that's the main reason. It's not fixing the number, the pathophysiology behind that number, which is causing the damage to the arterial system. And
Correct.
then basically the smaller arteries, bigger arteries, if you go in more detail, microvascular damage, macrovascular damage. So that's where all three silent killers we were talking about: blood pressure, blood sugar, and cholesterol. There's an
Cholesterol.
interlink between all three to lead to the major damage to our vital organs,
Correct.
heart, kidney, brain, all those.
Yeah. So just as a lay person, right, I'm just kind of thinking blood kind of flowing through the arteries, right? So arteries are
Yes,
basically like small pipes, right? And
yes, yes.
if the pressure is high, our heart kind of in an average life, it beats about a few billion times, right? And
That's
every
correct.
time this blood pressure, if the blood pressure is higher, is going to damage the interior lining of those
Yes,
arteries, right? And
yes.
that is what is the source of all sorts of problems,
Future
right?
problems. That's correct.
That is
That's
correct. Okay, good. So also, are you able to show us, like, for example, some people, they get anxious, there is anxiety, sometimes you have a problem, that's why you're going to see your doctor. And I walk into your office or my primary care doctor's office, and there is something called white coat hypertension, right? That means
absolutely.
just the idea of seeing a doctor, right?
Exactly. Yes,
That
yes.
increases my blood pressure or can increase my blood pressure, right? So can you talk about what's a good way to measure,
Yes.
for blood pressure? Under what condition should we measure it so you have a good baseline number, right?
So first of all, one reading does not decide whether it's done at home or in office or anywhere that you have a blood pressure.
Mhm.
So first of all, that every should be a very clear,
Mhm.
and that it has to be rechecked in a very sort of relaxing environment.
Mhm.
Always, if your blood pressure is high in doctor's office, it doesn't mean that right away you have to start the treatment. So what I recommend mostly, home monitoring is much more accurate, much more closer to what your actual number is. So you nowadays machines are pretty reasonably
Easily
good,
available. Yeah,
which are
correct.
as good as, in fact, I can just the machine like this, you can buy it from in Walmart or wherever, which
Correct.
are pharmacies, and they are digital, but they are, if you do properly. The proper way of doing that at home is uh, relax for a few minutes on your dining table, put your left arm, mostly we recommend left arm, is
Mhm.
just, and the heart and the machine should be at the same level. And then relax, take a couple deep breaths for a few minutes, take the first reading, And most of the time, even though you're trying to relax, doing your blood pressure on your own first reading may be a little bit higher
Mhm.
than what it is. So
Mhm.
you can discard that and immediately you can do second and third reading. Average of second and third, if it's about 5 points difference, that's your blood pressure at that moment. And you can make a note of that. So by doing this, you should do at least 2, 3 days on different time, morning, evening, before bedtime. And if you're noticing that, yes, your blood pressure is higher, then definitely it needs some intervention. So most of the time, I recommend lifestyle modification should be a first goal, not straight away a medication, and simple things, changing your salt intake, alcohol intake. If you smoke a lot, cutting down on the smoking, of course, stopping it, and a little bit increase physical activity, changing your dietary habits. And if you're overweight, then try to control the weight. Of course, these things are going to take time, not overnight. But if the number is not alarmingly high, then certainly these things can make a big difference. And that's what I would recommend.
Correct. And controlling this will help in terms of overall health, because you have tied blood pressure, elevated blood pressure, also known as hypertension, to a number of conditions, right? So best thing is really try to modify it and not get it elevated. If it is elevated, then you will definitely have to talk to your doctor, and there could be some medications that could be recommended to control it. But let me turn to some of the simple things that you mentioned. For example, most people know that if we have salt in our home, right, and you leave it out, right, it picks up moisture, right? It immediately picks up moisture, right? Salt is what we call as hygroscopic. It likes water. It will bind to water, right? So when we eat salt in form of what is called as sodium chloride, right, that sodium in the salt, right, sodium ion really binds to a lot of water, right? And so the more sodium that we consume, the volume of blood in your body is going to increase, right? And so now you're pumping more and more. It's like trying to force a lot of water through a small pipe, right? So that's why I think one of the most critical things when it comes to elevated blood pressure, also known as hypertension, is really if we can control the sodium intake, right? And sodium is hidden in so many different places, right? Almost 75-80% comes from processed foods. So can you talk about the idea of DASH diet and what does that mean? People may want to
basically,
know.
DASH diet is a dietary approach to stop the hypertension.
Yeah.
So in that diet, basically eating a lot of fresh fruits, vegetables, things high in potassium, your citrus fruits, banana, orange juice. These are little bit. So potassium does help to control up to some certain degree your blood pressure. And poultry, fish, plant-based fats,
And just
olive oil,
whole foods in
yes,
general,
whole
right?
foods, and complex carbs. So these are the few things you can change in your regular diet, and that's basically it is DASH diet.
DASH diet, yeah. And people can look this up. It's called DASH diet, dietary approaches to, stopping hypertension, right? And really, a lot of the sodium that we consume, I would say almost 75-80% comes from processed foods.
Most of the sodium is hidden, which
Hidden.
is in your processed foods, fast food, and people don't even know that
People
even though
don't.
these things are sweet, like your milkshake, you'll be shocked if you see the sodium content of that. So that's where the issue is.
Yeah.
We should be consuming about 2 grams per day, but in fact, on an average day, we consume 3 to 4 grams.
3 to 4
Even
grams.
though we are paying attention and we are watching in spite of that.
Yeah.
So that makes it very, very difficult to
Control it. To
unless you
control it.
stop using any extra salt at home
Yeah.
and intentionally cut down the salt intake.
Yeah.
It's very difficult to limit the
Correct.
salt.
And it will also help you lose weight because you have less fluid, so you won't.
Retention. Yes.
Right.
Yes.
Perfect. So I think we covered this first, actually the second alphabet, which is the B, right? The blood pressure, right? And what can we do to control it? And when do you see a doctor? How do you measure it? So that's really awesome. So let's turn to the another idea, which is not so much blood pressure, but blood sugar, right? So, glucose in the blood, right? So,
Yes.
and that's measured as a number, right? Can you tell us why sugar in the blood, right? Why is that such a big problem for a lot of people?
So the sugar also acts as a toxin. Basically, higher the sugar level is in the blood system,
Mhm.
disruption of endothelium, making your arteries more atherogenic, in a simple English, more sticky for your bad cholesterol, and then that leads to blockage.
Mhm.
Of course, if it does in your eye, the retinal arteries, that diabetic retinopathy, the it can lead to stroke, heart attack, kidney failure, poor circulation, and ischemia of your toes. So actually, sugar is like a toxin in your blood system,
Mhm.
and that's the reason it may not give you any pain or other unless it goes that higher, that you're having blurred vision or you're having other associated symptoms. You may not even know that you have high sugar.
Correct. Yeah, and that's the point with some of these things is right. They cause no pain, right?
No pain.
And at the same time, I don't think we are saying that, or you are saying. I shouldn't say we are saying, but I think you're not saying people should not eat anything that's sweet, or it's not. That's not the point. Right? The point is you can take, the sugar that we're talking about, right, comes from not necessarily sweet things. Of course, it will come from sweet things, but a lot of times, if you take white bread, right, if you
Yes.
take simple carbs like pastas, right, simple
Absolutely.
pastas, right, they
Absolutely.
are in form of what are called as carbohydrates, and these carbohydrates then break down into simple sugars, right,
Simple sugar.
and that is the issue. It's not necessarily just saying don't eat this or don't eat that. Correct?
The issue is the insulin resistance. I mean, of course, when we talk about diabetes or high sugar,
Yeah.
the issue is if you have type 1, which is basically you're lacking the insulin.
Correct.
So the sugar level is high and you have to take the insulin from outside,
Yeah.
externally. There's insulin pump or different ways. The type 2, which comes in adult, most of the time adult onset, is insulin resistant. So you do have insulin, but it's not working for you. The insulin's main role is to move the sugar from your blood circulation to the tissues,
Yeah.
to your muscle, to your other
Into the
parts.
cells. Yeah. Mhm.
It's a source of energy.
Yes.
And when that's not happening, the sugar
Mhm.
stays high in your blood system. And that's the one, the higher the number is, that's the one is act as a toxin, or you can say detrimental to our circulation system,
Correct.
mainly
Correct.
the arterial circulation system,
Correct.
leading to all major complications of diabetes. You must have heard about retinopathy, nephropathy, neuropathy, all these are the damages of the various
Yeah,
tissues.
yeah, and so I think people probably again the whole idea is like some of these things cause no symptoms, right? So you have no issues, right? Nothing to no, it doesn't hurt. Till there comes a point where basically like diabetes, it may not kill you, but all the other things that it will cause blindness, for example, right?
That's correct. That's correct.
Through
So
retinopathy. It will cause
that's
all
correct.
kinds of other issues, right? Increases your risk for
Yes.
stroke, heart attacks, and so on, right? So
So
that's
the
why
whole idea is
diabetes.
before the sugar starts damaging any of your the
Mhm.
organ system, we should, that's the reason monitoring, and nowadays monitoring of sugar is also so easy to do at
Mhm.
home. The glucometers, and then there is also continuous glucometers, continuous sugar monitors. You must freestyle libre, you must have heard. So these things, sugar checking at home is becoming
It's easy,
so easy.
easier,
And
yeah.
if you have family history, I recommend you should have a blood pressure machine at home. You should have a blood sugar monitor at home. These are simple things, and they're pretty accurately, they will give you some idea. So
Correct.
normal sugar, let's say, should be 70 to 100. And if you're keeping your sugar level in between that range, then you don't need to just, you can periodic monitoring
Yeah,
will give you a lot of assurance that you're not in that danger zone. And the pre-diabetic from 100 to 125, that's a red signal that you should pay attention and
yeah.
change your lifestyle, cut the carbs, exercise. Then we'll talk more in detail about that.
Correct.
Uh,
Correct.
so
Yeah.
basically, that's what the sugar's main role is. that, provide the energy. But if it's
Correct.
too much, then it causes
It will cause all
definitely.
kinds of problems. I agree. And I think again, once again, I want people who are listening to us or watching us to understand that I don't think Dr. Gupta is saying that you have to stop eating stop eating sweets or don't eat chocolate. Or I think the key is always going to be
Moderation. Yes.
moderation, right? Moderation is the
Absolutely.
magic word, right? So,
Absolutely.
so that is what I think we have to. And then, instead of eating white rice, you can try brown rice or eat a little bit of
Absolutely.
white rice or pastas, right? If you can
Absolutely.
switch to whole wheat pastas instead of plain pastas, right? So any kind of simple carbs you want to try to
Yes. So
minimize
now
because
there is a, I would like to mention the new pasta, the smart thing they did. When they make the pasta in the dough, they put the vegetables,
Mhm.
fresh vegetables. So they are green peppers, onions, carrots, celery. So those are vegetarian, basically vegetable based pastas,
Yeah,
which is also complex carb.
sure.
The absorption will be slower.
Sure.
They will not spike in insulin. So certainly there are options. Even if
Yeah,
you like the pasta,
absolutely.
sure.
Yeah, absolutely. And these are there are pastas that are available which are lentil based, garbanzo
Yes.
based, right? So there
Chickpeas,
are so there are different ways to and
cauliflower.
again,
There's so many options. Yes, yes.
absolutely. We have a lot of options to help with that. And again, the key is really not to sort of just say deny yourself of anything, but really trying to say, how can I make smarter choices, right?
Healthier options. Absolutely.
Healthier options. How can I read the labels very carefully? Like going back to sodium, for example, if you go to a place, I don't want to name any commercial chains, but you go to get a taco or you get, salad and you go to the condiments, that's where the sodium is. There's a ton of
Absolutely.
sodium in
Add-ons.
some of
Yes.
those.
Additives.
So
Yes.
just being mindful of that. Okay, good. I think we are doing good on time. I just want to make sure time goes by. We have so many things to talk about and
Absolutely.
to capture. Uh, so the other issue I want to come to, which is a lot of people, a lot of this has been in the news primarily because of some of the new medications for weight loss that have come up, right? But we'll get to that. But to begin with, right, let's just kind of talk about what is the uh, what is the issue of being overweight. I mean, a lot of people know that there is the prevalence of number of people that are either obese or overweight is very very high, and so why is that a
I, I
challenge?
I
Why is that a
think
problem?
most of them of sedentary lifestyle, our choice of food, fast food. Uh, I mean, there's different, and the role of genes, genetics also
Genetics.
plays a big role. So it's also multifactorial.
It's a
But of
multifactorial.
course, yeah, and basically, this easy way, whether you're overweight or not, body mass index is a rough way of saying that
Yeah.
yes, if it's your BMI is in the range of 20 to 25, so depending on your the body habitus, if it's a small frame, mid frame, large frame, if you are mid frame or small frame between 20 to 23 should be your correct weight.
Mhm, mhm.
And above the 25, of course, and then 25 to 30, then you are going into the overweight range. And above 30, of course, you're obese by definition. But the issue with that is that if a person who is 6 feet plus tall, muscular, bodybuilder, his BMI may turn out to be 35, 40, or 45. That doesn't mean that he's obese, very lean fat on the body
Mhm.
and no visceral fat. So it also body type, not just the BMI, one number will
Mhm.
decide are you in good health or not.
Correct. So let me. I'm glad. So obesity is a very complex disease. It's a very complex disease. Okay. Hold on one second. I just want to make sure. Sorry about that. My apologies.
Okay.
So I got a warning here saying my batteries on the laptop
Oh.
is really low.
Yeah.
So let me see what I can do
Take
here.
your time.
Second. Okay. Hopefully nothing will happen here. Sorry about that. Okay. This will be pretty bad if that's what happens. So
Okay.
coming back to the obesity issue, right? Why, obesity it has genetic component, as you mentioned, right?
Absolutely.
And it has lifestyle components. The genetic components, there is not much you can do. As they say, you can choose your parents carefully, right? So, and then the rest of the focus has to be on the lifestyle changes, lifestyle modifications, and one can definitely do that. So
That's definitely in your hand. Yes.
and people who are overweight and who are obese, I don't think there is anything that they should think somehow guilty about it, or they should think, oh, somehow they are not, up to it or something like that. I think they should really be focusing on the things that they can modify. Okay, so those are things I'm sure you'll agree. And I think you made the point about visceral fat versus subcutaneous fat. And there are studies that show that belly fat, for example, which is really the fat that is around your organs, that is
And
even more
yes,
dangerous than subcutaneous.
absolutely. Absolutely. In studies, and that's the one the toughest to move. So mostly by eating less or controlling your calorie intake
Yes.
may not move your visceral fat. So you will see in especially Southeast Asians,
Yeah.
their upper extremities are thin, legs are thin, but the belly is a little bit bigger than what should be. So that's where the visceral fat is, and that's definitely detrimental to the
Correct.
overall, all the comorbid conditions.
Correct.
And the only way you can move that is by exercising.
Correct. Correct.
Simple walking, bicycle, or doing the abdominal crunches, whichever, or playing
Correct.
some light sport, different
Correct.
sports. So some physical activity
Is
has to be
important.
done.
Is important. Okay, got it. So, and there are all other issues in terms of osteoarthritis, being overweight. You're loading your joints for every pound you're heavier, you're putting 5 times or more force on your joints, on your knees, on your hips. So there are all kinds of then down the road needs to get knee replacement, hip replacement, and a
Yes,
lot
yes,
of those
yes.
things, right? So with that, let me turn to some of the things one can do in terms of the importance of physical activities. We can definitely do some of that, right? Weight bearing
Yes.
exercises that weight training, strength training, a lot of that can actually help as well, right?
Simple one can start with the walking. Walking is the
Right.
easiest thing they can do. Nice walking shoes and fresh air, outdoor walking.
Yes.
That's the first thing I would recommend.
Yeah.
Second, if they do want to join some exercise regimen, maybe do under some supervision, or they can watch Pradeep's videos. And yes, and then
So,
weight training depends. I mean, how far, how much, active participation you want to take in that.
So physical activity, staying, especially strength training, weight training, and that has a number of other benefits as well,
And,
in
and
terms of stronger muscles, stronger bones. So we can have basically another
And
conversation.
even with your day-to-day activity, just simple walking to the work, walking from your car to the office, or day-to-day work. If you, by the end of the day, if you put in 10,000 steps, very easily Fitbit, different ways, your cell phone can monitor that. Even that's accounted for every single step you take.
Mhm.
So that's a good thing. You don't need to really join the exercise fitness club or whatever. If you're just being active, moving around, doing things, and that should be by the end of the day counted for.
Correct. Let me ask you a couple of things that are in the news, right? So one of the things that has received significant media coverage has to do with some of the new drugs that are on market, right? And some of them, they were originally drugs to control diabetes, and now
That's
they have kind of off-label, and some of them now are FDA approved. And what are, and they seem to, and celebrities on TikTok and the social
yes,
media, they keep on
yes, yes, yes,
pushing for these things, right?
yes.
So
So
they obviously have some legitimate uses in
yes,
terms
yes,
of
absolutely.
substantial weight loss, right? Almost 20%. But at the
Oh
same
yes,
time,
yes.
there are some real concerns, there are some real
So,
dangers. So can you tell our viewers what are some of the things
so,
that you
so
see as a
yeah.
physician?
So
Can
this
you talk
thing
about that?
came about with the chemical name is semaglutide, which is
Mhm,
Ozempic, and now the newest one, of course, is Wegovy, which is basically the same chemical. So how does it basically when it initially approved in the form of Ozempic was for the diabetic patients. So the concept is very, very good. It suppresses your appetite. It makes your insulin sensitivity a little bit better, and also basically, so that was for the diabetic patients.
mhm,
And Wegovy is now in a higher dose, also works to suppress your appetite, and uh, even non-diabetic patients are taking it. So as long as you're taking it, of course, you will lose weight, no doubt about it. First of all, it's expensive.
mhm,
Secondly, you have to be a little careful about taking this medicine without any, with just some health clinics or weight loss clinics are somehow prescribing that. I'll be very careful with that. There are certain, caution. If you have any history of thyroid cancer in your family or in yourself, you should be very careful. Or if you have any history of pancreatitis, multiple endocrine neoplasia, these are some of the issues which you should discuss with your PC family
mhm.
physician before you consider these medications. And of course, TikTok, YouTube, and all, I mean, everywhere it's all over that it's a miracle, magical pill or injection. Uh, on a certain extent, yes, if you do under supervision, it is very helpful. But as I said again, you cannot do this for whole life.
Mhm.
So that's where all these issues, they usually give you a chance to initially lose some weight. And then if you change your lifestyle for long term,
Mhm.
then they are definitely beneficial, no doubt about
And my understanding, and correct me if I'm wrong, and hopefully one of these days I'm going to have one of my good friends who's an endocrinologist to come on these one of these fireside chats.
that. Yes,
But
yes, yes.
my understanding is once you start on these medications, right? Basically, the way there are different variations, but the way they work is they will make you full. They will make you feel full, right?
Yes,
Uh, so
satiety. Yes, yes.
so it's not something I can just say, well, let me just take it for a few months, let me lose some weight, and then I'm just going to be stopping the medication, right? So that's not how it works, right?
Well, yeah, that's where the issue is,
Mhm.
that you cannot take this medicine for whole life. Now, the one which was described, given to the diabetic patients,
Mhm.
of course, they have to be on that to control the, and as added benefit, they are losing 15, 20 pounds of weight, which is heavily advertised about Ozempic
Mhm.
or Trulicity. These are the two out there. And but for the non-diabetic patient who are just taking your BMI is 30 or above and they're taking to lose weight, after losing certain amount of weight, they have to still if they're not changing their lifestyle, eating habits, exercise, they may have to continue that for long term to maintain that weight loss.
And they are
That's where
expensive,
the
and
issue comes.
yeah, and they are expensive, and very often they may or may not be covered by the insurance, right? So I think
Yes,
there are,
most of the time they're not. Yeah,
yeah. So as promising as they are fairly new. There's still a lot of unknowns, and it's not. If people are always looking for a magic pill to take, I think you will agree that that magic pill is actually exercise and physical activity, right? Staying active,
absolutely, absolutely.
which is almost zero cost. You can do a lot of things
Yes,
without much
yes.
equipment. Uh, and it's both. It's not just exercise, it's physical activity. That means
Physical
going for a
activity.
walk, playing
And
golf,
yeah, anything which you enjoy, even sports,
anything you enjoy.
tennis, yeah, anything, swimming, whichever activity you like, that's where you should
you should focus on. And I know you love to play table tennis, so I think that's your exercise. And
Yes,
whatever we enjoy, right? Gardening, as the weather gets better.
Anything, any physical activity should be a part of your routine.
Yeah, so that's kind of the other distinction, in terms of exercise. It doesn't mean you have to go to the gym. It doesn't mean you have to kind of work out. That's not. It's really staying active, right? So kind of make movement mandatory, right? The 3 M's: make movement mandatory.
Yep.
Walk around, stay active, do something, stay active physically. Perfect. So
that's correct.
That's good. That's good. And I'm just looking, on the clock. I think we are doing good on time.
Yeah, I'm glad you're keeping track of that.
Correct. So let me turn to the other issue here, right? Which has to do. I think there is nothing, no such discussion will go without talking about the role of stress in the very high levels of stress, anxiety that people face, right? And let me just show you. If you don't mind, let me show you one view graph. If I can share my screen here. 1 second. Let me see if I can do that first. Hold on 1 second. Share my screen and desktop 2. Share my screen here. So, and let me see if I can go to the. Are you able to see my slide here?
Yeah, this is all the slides in one page.
Yeah, 1 second. So I'm going to try and change it. 1 second. Stop share. Hold on 1 second. So presenter view and show 1 second. You know why it's not letting me share this the way I want it. 1 second.
So still having some glitches.
Yeah, I mean, it's never. Technology is great when it works. That's what they say.
There you go. That's the slide.
Okay.
All slides in together.
Okay. Now you can see this. Sorry about that.
Yes.
My apologies. So
wandering mind.
Yeah. This is really, really important, and I just wanted to take the time, despite of some of the technical issues I'm having with here. Is in 2010. Okay, there was a very influential study that came out from Harvard, and that said basically that a wandering mind is an unhappy mind.
Unhappy mind.
And this study showed that almost all the time, maybe like 60-70% of the time, our minds are wandering. That means we are not really into what we are not in the present moment. Let me just put it that way, right?
That's correct.
We might be eating, but we are not really paying attention to what we are eating. We are thinking about something else, okay? We might be reading something in front of us. You might be in an office meeting, but we are thinking about something else, right? So wandering mind, right? And this study really highlighted, right? Let me just stop this for a second. This study really highlighted what happens when our minds wander, right? And why this is, give me a second here, stop sharing. So it really comes to why, with the availability of social media, with the availability of TV in front of you, so many screens, right? And so many things going through our heads, right? And that's why this particular study showed that a wandering mind is an unhappy mind, right? So if we kind of flip it around and we say, a focused mind is a calmer mind, it's a more rational mind, and so on. So the levels of stress that we see, are incredibly high, right?
Incredible. Yes.
And
Yes.
if you look at some of the very recent literature, new books that have come out, there is one that comes to mind to me by a cardiologist, is Sandeep Johar, who has
Mm-hmm.
written a beautiful book on heart history. And the main conclusion of his book is that doctors can control your cholesterol. And Dr. Indu
Mm-hmm.
Purnima, who is going to be
Sure,
featured
sure,
as a
sure,
next
sure.
speaker, she's going to
Yes.
talk quite a bit in detail about cholesterol. That's why we didn't discuss it as much. Uh,
Mhm.
but doctors can control your blood pressure. They can advise you on how to manage it. But the role of stress, right, has a huge effect. I don't think people appreciate it as much in terms of heart
Absolutely.
health, right? Cardiovascular.
Absolutely.
So, can you talk about what are some of the things we can do in terms of
Sure, sure.
staying calm, lowering our stress
Mm,
levels?
sure. So with our busy lifestyles and all that, the most commonly I have seen, we are not given even 5 minutes to ourselves.
Mhm.
So I preach to all my patients by the end of the day, sit down, relax, try to focus on yourself and stop your cell phone, stop your beepers, pagers, whatever you have, and just do a couple minutes of deep breathing. They'll try to relax. If possible, basically that's what meditation is. You don't need to do any fancy, mode of that.
Mhm.
Just relax yourself, deep breathing. And I think listening to a nice music and even simple walking can be very stress relieving. So stress is definitely plays a role, not just in most of the things we discussed. In weight, cholesterol, blood pressure, sugar, stress has a role in all of these all of these factors. I think the uh, not just taking the medications for your anxiety or stress.
Mhm.
If you do simple exercise, I mean the meditation, yoga, listening to the music, these are all things you can do on a day-to-day basis to relax yourself.
So that's really, and these are very low cost or no cost interventions, right? I mean, they
Absolutely,
require
absolutely.
absolutely nothing. So a couple of things I want to just point out is I think at least a lot of people that I talk to, they don't exactly know what deep breathing is. And I think what is important is one thing one can do is really, and this is what I do in my strength training class, almost every one of them at the very end, we just ask people to put their left hand on their chest, right hand on your belly. And when you take a deep
That's
breath
good.
in,
Deep breath.
the right hand should rise, right? The belly should come out, right? So that's called deep breathing. And when
Deep.
you exhale, the belly kind
Yes.
of goes in, right? So it's only the
Yes. Yes.
right hand that moves back and forth. The belly is kind of doing that's diaphragmatic breathing.
And also, I tell them some very simple trick to stop their wandering mind. Is it's hard to control. So basically, they do the deep breathing and start humming with that. Sometime
Mhm.
humming stops the thinking process, all the running around mind, or uh, they can focus their mind on how they are breathing, where when they are
Yes,
taking the air in, when they are breathing out,
focus
how
on the
many
breath.
times.
Yeah,
So just the distraction of your mind
yeah,
from the other day-to-day whole day's
yeah.
issues to focus on your breathing, focus on the humming also helps you in that. Even 5 minutes of that, if you can master 5 minutes, you'll be surprised how relaxing that is.
Mhm.
And if you can do 5-10 minutes every day, every night before you go to sleep, it you may not need a sleeping pill or so,
Yeah.
or any
Lot
other
of these things have been
chemical.
shown,
Yes.
exercise, deep breathing, they are shown to be as good as antidepressants, in many, many studies, right?
Oh yes. Head to it. Yes. Absolutely.
So again, and there is nothing, a lot of people have misconception. There is nothing absolutely anything religious about meditation. Everybody breathes, right? So there is no,
That's right. It's a
there's no,
process. It's not any same for yoga. It's a process. It's the way you do. It's not that certain religion is promoting it or doing it. Nothing like that.
yeah, and that's where the whole notion of mind and body, right? When we talk about mind-body connection,
Absolutely.
mindfulness, all that is automatically going to help you not only just relax in terms of your stress, but if I'm eating, right, mindless eating, right? If next week will be Super Bowl, right? And it's again, the point is not to
There
eat,
goes your
not
dash
to eat
diet.
this or not to eat that, but just being aware, right, that I am
Yes,
eating. So your brain actually takes note of that. And it's
absolutely.
not simply just chugging along, right? So just being mindful helps in number of ways in terms of your ability to focus. So that's where we are going through these alphabets A through F, right? A was for the A1C. We didn't talk about it as much, but we talked about glucose, right? B was for blood pressure. C is for cholesterol. Let me turn to something that I skipped in between, right? Which is
Sure,
the
sure.
D was really for vitamin D, right?
That's correct.
And
That's
and
correct.
and what
That
I meant
that's
by that was really in a broader context. What do you think of supplements, dietary supplements, vitamins? What's your
right.
take on that?
Yeah. My take is if you're eating a healthy, well-balanced diet every day, a lot of fruits and vegetables, there is no need to take extra supplements. But if you're not sure, well, I mean, sometime and some people don't like to do too many vegetables in their diet.
Mhm,
They don't like greens, spinach, kale, and broccoli. Okay, then it's a different story. And now, after a certain age, there are some studies do show
mhm,
benefit of taking, just the daily requirement, multivitamin, and those. Vitamin D, definitely I will promote, I will recommend, because most of the Northeast zone, the residents, are deficient, most of them.
mhm,
Not just lack of sun, but overall, I mean, vitamin D level, even in young kids, is being noted to be low.
mhm,
That I will recommend to do the vitamin D level if we can. If not, you can take 2000 unit, international unit, as a supplement, and especially after 50. And if younger age, if they are low, of course, you can take depending on your level. Sometime in very, very low levels, we have been given even 50,000 unit once a week to
mhm.
just boost up the level and then maintain it. So vitamin D, I definitely recommend, not just for overall muscle health, bone health. It's also beneficial in your immune system. I'm pretty sure there are multiple news media talking about the COVID virus, the zinc supplement, vitamin D. So retrospect, they saw people with a higher vitamin D level did better,
Mhm,
better, or they did not get even infection initially. Same for the zinc. And zinc now recently, just there was an article published, ICU admitted COVID patients, they did much better if the zinc level were optimum, or in the higher levels. So those definitely I do recommend. Calcium, I do recommend, especially in females, postmenopausal, or they're preventing osteoporosis. So
correct.
these are the few things. But if you're eating a well-balanced diet, a lot of fruits, vegetables, dairy, eggs, and then basically you do not need supplements.
Correct. So again, just to be clear, right, what we said in the beginning is anything that we discuss is not to be treated as a medical advice as such. So I don't want
Absolutely.
people to just start taking something. I think what Dr. Gupta is saying is that some of these things have been shown to be beneficial. So I think people, if you have any doubt, they should really talk to their primary care doctor and just say, I just met somebody yesterday and one of my friends, and she was telling me that she was diagnose exactly what you just said, which is low vitamin D level. And, that came up just with her physician visit and they did this testing and she's doing great now with the vitamin D, but it shouldn't be like just go and start something on your own. I think people should, there is a place, if I hear you right, Dr. Gupta, what you're saying is there is a place for certain types of supplements, for certain types of people or some people,
Absolutely.
uh,
Absolutely.
but you got to follow your physician's advice and certain things, for example, calcium to reduce the risk of osteoporosis, vitamin D certainly, some and folic acid for expectant, pregnant
Yes,
women.
yes, yes,
That is
absolutely.
like a very well-known.
And one thing I will not recommend, which is also because of the hype of media and all, the super vitamins.
Mhm,
People are spending a lot of money and mega dose vitamins, 1000%, 2000%. there is no proven benefit of those. In fact, they can be detrimental in long run, can hurt your kidney, liver, and all that. So I would definitely not recommend those.
So I think that's really important to know. So we again, just to recap, right? We covered alphabets A, right? A was for A1C, which is the long-term measure of blood glucose, right? We didn't quite get into all the details on that. B was lowering the blood pressure or the importance of maintaining low blood pressure. C was cholesterol. We didn't talk about it as much. We'll be covering that with Dr. Purnima. D, like I said, was really vitamin D, and not just vitamin D, but just the role of supplements and vitamins. And a lot of supplements, people, Dr. Gupta, you'll agree that a lot of them are not FDA approved or FDA, they don't need FDA approval the way they are marketed.
I think, Pradeep, you have a...
Can you hear me?
Oh, yeah.
Can you hear me?
Now I think there was a little glitch on your video.
Okay, sorry. Yeah, go ahead.
Yeah. So I missed the last part. I think there was a little glitch in your
I'll
audio.
repeat. So what I was trying to say is a lot of these supplements, they are not necessarily FDA approved, right? They're not FDA approved. A lot of them.
Absolutely. Yeah.
And so you don't know what's in those supplements, right? So
that's exactly
one has
right.
to be very careful, right?
And what conditions they were made, how they were made, and how true it is with what they are saying on the bottle, what's in there, what's in them. So that's the major issue with these supplements.
Correct. So one has to be very, very careful with that. So I think, we are almost on the hour now. It's just past 3 o'clock. I know we started a little bit later. But let me just see if I can do this for a second. Let me, despite of all the technical things that I'm running into here.
Yeah.
I just want to see if I can show this. Okay. So are you able to see this, Dr. Gupta?
Oh, yes.
Okay, perfect. So this is something I really wanted to share this, because I think this is the
excellent
time issue. Yeah, this is the time issue, the time cover story from many years back, 2016. And basically it talked about the exercise cure, and people can go back and look at this, look this up. So almost everything we talked about, right? And the right-hand side, the right panel on that slide is an article by Laura Landro from the Wall Street in 2010. And this is one of my favorite articles, if I can call that. The reason for that, right, and we can speak to this, is almost everything that we talked about, right? You can do much better. Exercise has many hidden benefits. Right? It has so many hidden benefits, from boosting your immune system to stronger bones, reducing your risk for osteoporosis. Cognitive benefits. It has been shown to. We didn't get into neurodegenerative diseases like dementia, Alzheimer's, Parkinson's, but all of that. So can you say something about, a little bit at least, about what is the beneficial effect when it comes to some of the cognitive or neurodegenerative diseases such as dementia, Alzheimer's? When should people worry about that? What is normal forgetfulness? What's normal cognitive decline, and what's not normal cognitive?
So when we are noticing in any family member, missing a key or forgetting this thing, that these are very common. Significant forgetfulness, especially the short-term memory. If they are, basically not able to do their routine, writing checks, paying their bills, all those are significant issue. I mean, that's where I think they need to be seen by neurologist or primary care physician that they are
Mhm.
becoming more forgetful. It could be a
Mhm.
sign of early Alzheimer's dementia.
Mhm.
And then basically they will do the proper evaluation and decide about. So most of the time, it starts as a mild cognitive impairment. And if it's caught in time
Mhm.
and evaluation is done, probably we can slow it down.
Slow it down.
There
Yeah.
are certain, yeah, we can slow it down. And even now they notice the people who are more physically active.
Mhm.
And if even you start exercise in Parkinson's,
Mhm.
dementia, there is some role of stabilizing your
Symptoms.
decline, yeah, symptoms.
Yeah.
And even there is some improvement in their
Oh, I see.
functionality.
Mhm.
Yes. So definitely exercise plays a big role in that too.
Correct.
And
Correct.
cognitive impairment, I think it's much better to diagnose early than later.
Correct. Correct. Correct.
And most of the time, family members are the one they notice that and there is nothing wrong
Correct.
approaching the physician and then mentioning that and getting a full evaluation.
Correct, correct. So just to recap, right? I mean, just to kind of rephrase what you said, is if you kind of forget somebody's telephone number, of course, nowadays nobody remembers any telephone numbers. But if you forget somebody's friend's name or something, or where you kept your keys, that's not necessarily a huge
No,
problem. You know,
yeah,
that's the part of normal cognitive decline, right? But
absolutely.
if you have somebody, your husband, your wife, your relative, your mom, your dad, and they are, say, used to going from, say, your home to a grocery store and coming back. And now if
Yes,
they one day they tell you that, I couldn't, I couldn't figure out how to get home. I think that's
that's significant.
something
Absolutely.
should be of concern. That should
Yeah,
be of
absolutely.
concern. And
Absolutely.
that's what you're saying. And the second thing,
Yes.
there is studies that have shown that almost one third of the dementia is actually preventable uh, with vigorous exercise, because the blood flow
Yes.
to the brain increases, and so on. Uh,
And,
and
few other things I will add to that,
yes, please.
that before we, that's as an initial workup, there are some dementias which are totally reversible, like B12 deficiency.
Mhm,
They should check their thyroid function, B12.
mhm,
It's like basically evaluation. If any
mhm.
concern, I think they should definitely approach the family physician, and appropriately they may refer to neurologist if it looks like needs a further evaluation.
Mhm.
Otherwise, their B12 level, their thyroid function test, they should be monitored. They should be checked, because these conditions can make them feel they're almost having forgetfulness or
Correct,
dementia, but that's basically due to these issues, and which
correct,
can be reversed.
correct, correct,
They are
correct.
reversible causes. And now, and that, of course, after evaluation, you'll figure it out.
Doctor can tell you.
So, yeah, yeah.
Yeah, awesome, awesome. So, again, I think the role of exercise, physical activity, in not just kind of nothing can really prevent everything 100%, but it can be delayed substantially. So, if somebody is likely
Absolutely.
to develop dementia when they are 80, and if you can
Yes.
push that out by, say, 5 years or 10 years, so the emphasis is really on the health span, not the lifespan, right? So, a lot of times,
Absolutely.
that's what I think the idea is. It's not about, nobody knows how long we are going to live, but you can certainly do everything you can to really
Yeah.
push for
The one
the
more thing I would
lifespan.
like to mention, like we do the uh, physical activity, exercise, but there is a need for the brain exercise too.
Absolutely,
So
absolutely.
brain stimulation is very important by doing some memory. Nowadays there's so much available on computers. If you
Correct.
do nomosity.com, there's so many sites
Yeah.
where you can practice your memory. So you can do memory games, and
And social
that's your
engagement.
brain.
Yeah.
Yeah,
And
absolutely.
social engagement, right? I mean, having,
Yes, 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 yes.
talking to people, being part of a group, right?
Absolutely.
Those things go a long
Stimulation. Yes, yes.
those things go a long way. So we just have like 2 or 3 minutes. I just want to recap what we discussed, Dr. Gupta. We covered a
Sure,
lot
sure.
of really really
Yes,
want to
yes,
thank you. I know you volunteer your
yes.
time here. You could be,
Absolutely.
doing so many other things with your busy schedule, but I really want to thank you.
Had a
And,
great
and
time. Yeah.
And really, again, the reason why we showed this Rubik's Cube, right? That's my way of looking at the interconnectedness between all of these things that you see here. We didn't talk a lot about the last alphabet, which is sleep, but it's very
Very
restorative,
important.
right? So can you say a
Yes.
couple of things about
Yes.
how long we sleep and the importance of
Yeah.
that?
So the sleep is also very important. If you indirectly say like it can impart your cholesterol level, blood pressure level, yeah, and even the various things we talked about. So sleep is as important as other issues we mentioned. And lack of sleep or restless sleep, all those can impart a big role in your health,
Correct,
overall health.
correct, correct.
So if
So,
anybody has very restless sleep or loud snoring, or they should be definitely checked for obstructive sleep apnea, which is also very something which does not causes any pain or any, unless you suspect, you will not be able to go for diagnosis or the
correct,
testing. And it's a very simple way sleep study and gives you the answer. And if you have it, appropriate treatment in early onset, early phase is
correct,
can be very, very beneficial.
correct, correct.
So
Absolutely.
sleep,
So,
quality of sleep, and 7 to 8 hours, everybody knows it's the quality of the sleep is more important than the time, the length of the sleep.
mhm.
So
Absolutely. No. So
yeah,
I think I hope people get it's impossible to discuss what we discussed in great details, everything that we talked about, but I think you did a really wonderful job. I just want to remind people or mention to people who may not know, we'll have another chat that's with cardiologist Dr. Indu Purnima. She is a renowned cardiologist with Allegheny General Hospital in Pittsburgh. So that is coming up. Next week is Super Bowl, but the week after that is really after Valentine's Day. She will be talking about heart issues. So we'll get into a lot of detail on cholesterol and a lot of other stuff related to heart health in the context of nutrition. So, and she is outstanding, just like Dr. Gupta, you have been truly exceptional. And then another one we have planned is on March 5th about dental hygiene and dental health and oral health, I should say. So those are some of the things that are coming up. Now, let me just stop sharing this. So we are almost on the dot here, Dr. Gupta. I really, really cannot thank you enough. I want to thank all of our friends who joined us on Facebook Live. And since this is recorded, we'll also be making it available on YouTube later on. So again, I want to appreciate my deep gratitude. I know how valuable your time is. And
thank you for this opportunity, Pradeep. This was really very, very enjoyable, very, very nice, informative, very nice.
yeah, and I hope people can people will learn something from this. You can
Yeah,
take some of the
that was the
takeaways.
whole idea. Sure, just to focus more on preventive care
Yeah,
than having the taking a pill.
correct, correct.
So yeah,
Yeah, or having a surgery or having,
yeah,
I
yeah, yeah,
think those are also valid options, but I think the focus hopefully is on prevention and staying healthy, focusing on that. And that's really all about quality of life, staying independent,
absolutely.
and all those good things. So again, thank you, Dr. Gupta. I'm going to take
Thank
you
you.
out for dinner one of these days. Let's hopefully soon.
Well,
It's just a token
make
of
sure it's a DASH diet, Pradeep.
we'll make sure it's low in sodium and everything else,
Yeah, yeah,
high in
yeah,
complex carbohydrates.
yeah.
So thank you again. Thanks to all
Thank you.
our
Thank you
listeners for
all.
joining
Thank
in,
you.
and
Absolutely.
have a good day. Okay. Thank you.
Absolutely. We'll do it again. Thank you.
My pleasure.